Hello everyone, I am Dr. Srinath, consultant neurosurgeon at Renova Hospital, Kompally. Today I am in front of you to speak on the topic of spondylosis. This spondylosis is a disease or a degenerative process which we commonly see in the spine. Due to the regular use wear and tear of the spine, the bones in the spine usually undergo slow degenerative or what we call wear and tear process, where the structural integrity of these bones and its associated tissues will come down both in quality as well as quantity. So when we encounter this spondylosis, it is usually in the form of a pain in the associated area. So the most commonly we see the spondylosis change in the cervical or the neck region or lumbar or the lower back region. So both these regions have the same method of degeneration. That is because of the mobility of that region, we encounter these changes. Over a period of time, depending on the load we put on the spine as well as the method we use our spine, there will be a loss of bone as well as a decrease in the stability and structural integrity of the spine or vertebral column, which can lead to degeneration called spondylosis with results such as pressure on the associated nearby structures, most commonly the spinal cord and the nerves. When we encounter this process in the cervical region, we call it cervical spondylosis. Most commonly, the symptoms being neck pain, stiffness, radiating pain in the upper limbs on both the hands or one of the hands, and also tingling sensations and numbness in the one of the hands. So when we see the stages of this spondylosis, the initial stage we encounter is the pain and stiffness stage. When we see patients in this stage, usually physical rehabilitation such as physiotherapy with medical management can give relief, and also further prevention of the wear and tear with precautions can lead to a slowing down of the spondylosis. If we see this patient in a next advanced stage, we encounter the radiating pain of the neck to the one of the hands, and usually this is the indication of the nerve being pressed in the spinal cord, where the degenerated part of the spine or the disc which we see in between two vertebral bodies comes out of its natural place and start pressing on the nerves on the spinal cord. So the next stage being the weakness or numbness stage, where the muscles being in the hand are affected, leading to weakness, loss of power, loss of function of the upper limb, and also the numbness which we encounter leading to trophic changes or pressure changes, which we in the form of ulcers or other things. So when we encounter the patient in this stage, usually it is advanced and usually requires intervention in the form of surgery, where we go to the point of the pressure inside the spine and try to free the nerve or spinal cord from the pressing factors. The same pathology which we encounter in the lumbar spine will commonly cause a lumbar prolapse intervertebral disc, or which will lead to radiating pain along the lower limb called sciatica, and also the same treatment modalities will be accepted in the lumbar spine. So whenever we encounter this problem, we try to relieve the nerve from the pressure point with surgery, and also give the augmentation to the structural integrity with implants such as plate and screw, so that the structural stability is improved, as well, therefore leading to a decrease in the pain and further degeneration of the spine. So all this treatment should also include medical management such as painkillers, to tablets to improve the structural integrity of the muscles and bones, such as calcium and muscle improvement supplements, and also rehabilitation, which is more important in these cases, because any loss of power in the muscles we should be followed up with physiotherapy, exercise therapy, and further methods to improve the power of the limbs, so that degeneration can be slowed down. Thank you.